Hey everyone, thanks for tuning in and welcome to Quick Tips. Steven here with Team Euphoric, and this week we're going to be going over 3 exercises to help decrease your low back, hip, and knee pain and improve your posture. Over the last few days, we've discussed how a lot of low back, hip, and knee pain stems from dysfunction in the lumbopelvifemoral complex, and how one of those common postural faults is going to be excessive anteversion of the pelvis. So we ended up focusing on strengthening the rectus abdominis, the lower fibers, and also the gluteus maximus deep fibers to help balance out the pelvis. One more exercise that we could focus on is strengthening the hamstrings, particularly the proximal fibers or the fibers closest towards the ischial tuberosities. Your hamstrings group, one of the attachment points is going to be the ischial tuberosities. And what's going to happen is as that muscle becomes shorter and as it becomes stronger, it is going to drive the ischial tuberosity down toward the ground and bring us more into a retroverted pelvis or a posterior pelvic tilt. So one of the exercises that we can do is a Nordic curl. With regard to the Nordic curl, you could either dish out the money and get a Nordic bench, but if you don't want to spend the $600 to $700, you could also get one of these cheap little $20 attachments on Amazon that you could place under the door, or just get a band and you could place it on a bench. But what you would want to do is you're going to start off in this kneeling position. You're going to go ahead and you are going to anchor your heels. You could also do this with a partner if you want no equipment whatsoever. But from this position right over here, what we're going to do for the Nordic curl is we want to bring our chest as close to the ground as possible. When you're first performing this exercise, you may not be able to go all the way down, so just go as far as you comfortably can. Once you find that you're able to build up a little bit more strength and then you're able to get a little bit lower, what you could do is start to focus more on the eccentric portion and use your hands to propel yourself up. So you're just going to allow yourself to go nice and slowly until you can no longer maintain it. Then you're just going to drop and push yourself back up. So you're going to go nice and slowly, drop, and then push yourself back up. And then eventually what you should be able to do is you should be able to lower yourself all the way down to the ground and then come back up without using the assistance of your hands whatsoever. But go ahead, give this exercise a try if you want to eliminate your low back, your hip, and your knee pain.